we all grow as people and professionals. And I think that's really important. And it's good to reflect. Like you said, we're kind of reflecting on just the last 4 years, but I've been doing a lot of reflection over the last 10 plus, just kind of
Hmm.
thinking about where was I at one point, where am I now, and where do I want to be in our profession? And it is humbling, exciting, thought provoking, and also just fun to kind of think about the growth and the work that we do as PAs and the care that we provide and why it's so valuable.
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology one story at a time and connect with the people behind the diagnosis. Every year on Pathologist Assistant Day, I sit down with Marissa Spencer to reflect on the profession and where it's headed. And this is now our 4th year doing exactly that. We talk about how the relationship between PAs and pathologists is becoming more of a true partnership, and how teaching is shifting from just learning steps to really understanding the why behind what we do. We also look ahead to the future of PA education and how PAs might play a bigger role in patient care. All right, let's get into this special PA Day episode with Marissa Spencer. So I'm back here with Marissa Spencer. Once again, this is our special PA Day celebration episode. This is our 4th year in a row doing this one. And I want to start with, now at 4 years, your perspective of our field, our profession. How has that changed over the last 4
Oh
years?
my goodness. Well, I think it's changed a lot over even the last year, 4 years, 10 years. But
Sure.
one of the biggest things thinking about the last 4 years that I think has changed, honestly, is our working relationship with pathologists. I think in the past, and even currently, there's
Hmm.
kind of been a hierarchy. Even if you think about our job description, it discusses PAs working under the direction and supervision of a pathologist. And I understand the intent of that and why that verbiage is used, but I actually think we're much more collegial with pathologists now than we ever have been in the past. And a lot of that is because they really are so removed from the gross room now. When you think about residents and their educational experience, they're in the gross room less and less. They're focusing on things beyond the bench more and more, like molecular and other areas. And really, they are relying on us so heavily. We truly are, as PAs, the gross experts. And to me, that relationship is less of a hierarchy now and more of a partnership. Because at the end of the day, if you don't know what to sample or how to maintain a relationship, it's not going to make it to the scope for the pathologist to see. So there really needs to be a true partnership and trust in your PAs from a pathologist perspective to know what you're looking for, what is needed for that case, and how to appropriately sample it so that the pathologist can see it, appreciate it, diagnose, comment on it. And to me, I think it's more of us working side by side rather than in this kind of hierarchy that I think existed a little more in the past.
Yeah. No, I like that. My current job, I've been there 8 years, and, I have the trust of the pathologist there. But when I came there, my previous job, I'd been there, I think, 14 or 15 years. And so I had that same trust. And then coming to a new place, you have to build that again,
Oh my
which was difficult. So I'm sure we've got students that are going to be listening, new PAs, things like this. So can we talk about what might be some ways to help build that trust maybe faster?
It's so funny you say that because I actually tell my students this constantly. I say, whether you are a student, a brand new grad, or you've been practicing like myself for over a decade, or even people like you, 20 years, when somewhere new, it's a blank slate. And you
Yeah.
do have to build trust. And it kind of can feel intimidating, like you're starting over. But I really believe your work speaks for itself. So, what I tell students is your knowledge will show in the quality of your gross, in the quality of your sections, in the quality of the gross descriptions that you're creating. And honestly, in the conversations you have with your pathologists, there's a very big difference between when you're consulting with a pathologist on a case. Let's say that's the standard. Maybe your pathologist wants to see a specimen before you gross it if you're new at a place. If you say, well, what do you want me to do? Versus, hey, this is my approach. This is what I'm thinking for this case. Are you in agreement? That's a
Oh,
very
I love
different
this.
conversation. And
Yes.
that helps build trust because they recognize, oh, okay, this PA knows what they're looking for. They know why it's relevant. I can entrust in the work that they're going to give me and that the sections are going to be what they need to be. I think that's really what should be your focus. And it has, again, the mindset that you are going to have to kind of start over every time you take a new job, regardless of your years of
Hmm.
experience. And that's okay. You have to kind of be confident enough in yourself and be self-aware to know your limitations and ask questions as needed, but also have confidence to know I know what I'm doing and I know how to provide high quality patient care. Those are kind of the things I think are really important to focus on when it comes to building those relationships and building that collegial relationship with pathologists.
Yeah, I 100% agree. I tell that to our residents sometimes too when they're grossing and they need to call in the attending. And I say, look, don't say, what should I do with this? Exactly like you just said. Say, this is what I'm going to do. What do you think of my plan?
Yeah. And I
Right.
also think it's okay to have, I call them courageous conversations when you have to have a difficult conversation. Maybe you don't see eye to eye with someone. There's a way to do that professionally and appropriately that shows your level of care and knowledge in the gross room. I've had pathologists who maybe have very specifically in their head kind of a black and white way of what they want, how they want something done. And I've had to say to them, "Oh, I definitely appreciate what you're saying, but I actually think that a better way to maintain that relationship is to take it this way instead." And if you want to approach a specimen differently than maybe the initial intent or the thought behind the pathologist, if you have a valid why that's going to actually help the quality of the care that the patient gets, most pathologists are actually open to that. But I think if you don't articulate that appropriately, they don't want to trust in you veering off to something different or something new because they want to make sure it's done the right way. And again, doing something different can be scary. And you want to make sure that if you are going to do something that's maybe not exactly what they're looking for or a variation of that, that you have a reason behind it, that you can back it up by something that's really going to affect the patient. And having those conversations, like I said, it does take courage to kind of say, oh, I actually was thinking about approaching it this way, and this is why I'm feeling that way. But if you can do that, that also really builds trust and collaboration. It's really is very helpful to have those conversations, even though they can be difficult sometimes.
Yeah, I can see that. I mean, especially if you're new, that's got to be difficult and a little bit scary. Do you think there's a way you can practice doing that in kind of a less scary environment, I guess?
I think definitely. I think it really depends on where you are in your level of experience learning in your environment. There's different ways to approach this. So, like from a student perspective, I would say when you're studying and you're talking about how to approach a specimen and what you want to do with a case, you can practice describing that, not writing it out, but actually telling a classmate about how you were going to approach a case. Kind of get
Okay.
familiar with verbalizing it. From a work perspective, maybe you have a colleague that you feel comfortable talking to a case about, and you're like, hey, I want to talk to the pathologist about this. Before I do, can I talk to you about how I want to approach this case? That might be something that's more comfortable for you to do. And rehearse sounds bad. You don't want to be rehearsed, but I think that helps you kind of feel more comfortable and confident in the verbiage that you're using and the conversation that you're about to have. That's a good way to do it. And then eventually, honestly, I think ripping off the band-aid, you just kind of have to do it. Sometimes
Mhm.
there are a variety of personalities in pathology, which is a really cool part of our profession, I think, is that there's a plethora of personalities, lots of different perspectives, and you really have to navigate personal and professional relationships. Even though we're not patient facing, we have to do quite a bit of that. So sometimes you just have to rip the band-aid off and have a conversation with somebody that maybe is going to be challenging, but you have to just have the courage to do it.
Mhm. Mhm. So then what if it goes badly? What do you do about that?
Oh, I mean, I've definitely been there.
Oh, me too.
Oh, that's hard. I think it really depends on the situation. This is not a black and white thing, and I know for some people that's hard. There's a lot of gray, I think, in
Sure.
pathology, even though people don't necessarily agree with that. I've had conversations where I approach it professionally and I say, "This is what I'm actually thinking, and this is why," and the pathologist says, "No, this is what I want." And there have been times where I've done what they want based on the conversation, and there have been times where I still have kind of gone with my gut. And I think it really depends on a variety of factors. One of those factors, truthfully, is gonna be, is this going to truly make an impact on the case? Is it more of an inconvenience for me Or is it
Mm.
that I really am concerned that this is going to negatively impact the ability to stage this case appropriately or get a section, maintain a relationship appropriately? Or is it just that, oh, it's more of a pain for me to get this section in this plane? If it's more that it's just a pain, I'm going to do what the pathologist is asking because at the end of the day, we do need to work together. And if that's the way that they are envisioning this and that's the way they're going to best interpret the section, I'm happy to collaborate and make adjustments as needed. I think that's important. And if you feel like this is going to compromise that case, I mean, I truthfully, this may be controversial, but I've been like, you know what, I'm going to do, I think, what I discussed and what I think is right. And if the pathologist comes back and says, well, why did you take it that way? I'll say, well, I looked at it and I really felt that this was the best way to do it. And the other way was not going to get that relationship that you wanted, or I knew it was at the margin and I didn't want to shave that margin, whatever it may be.
Mhm.
Um, if that makes that person upset, we all have good days and bad, right? There are times where people can be frustrated by something, but I think holding grudges at work is not it's not healthy to do that. And I've never really worked with somebody who would do that because at the end of the day, we're a team and our goal is to make sure that
Right.
our patients are getting the best quality care that they can. So while that might make an uncomfortable situation happen, or maybe have some tenseness for a day or two, I truly believe that eventually diminishes at least, especially if you can have a conversation afterwards, after the case and say, hey, I'm sorry that the conversation didn't really go the way that I had wanted it to. I appreciate that you spoke with me about it, kind of trying to ease it and just talk to them about the situation might help if you feel like it was really tense, or even just talking to a colleague about it and saying, "Hey, I had a conversation that was kind of difficult and didn't really go the way that I wanted it to with that pathologist. Is that a normal thing? What do you think I could have done better in that situation?" And leaning on your colleague for advice, I think is a good idea too.
Yeah, I like that. I like that. Then I mean, you're still trying to learn something, whether it's a particular grossing skill or this. I think you're talking about this kind of interpersonal skills, right?
Yeah, absolutely. I mean, one of the reasons it's probably the number one reason I love our profession is that we are truly lifelong learners. I learn something new
Yes.
every single day, I feel like, of my
Yep.
life, not just about pathology or gross per section or things beyond the bench, but just even interpersonal and professional skills. I think that's such an important part of our profession that's very much overlooked because we aren't patient facing. I think people think that if you work in a lab, you're kind of just have your head down and that's it. But I actually would argue that a lot of us talk to more people on a regular basis than people who are even patient facing because as a PA, you have to interact with pathologists, histotechs, accessioners, cytotechnologists, surgeons, oncologists, radiologists, nurses, OR staff. I mean, you name it, you're talking to somebody about something. Maybe morgue attendants, funeral homes. There's so many different people you have to collaborate with to ensure that the care you're trying to provide is done appropriately. And every step is different in that process, and everyone's perception is different because of their steps being different. So, really having appropriate professional conversations with each member of the team can be challenging because you're coming at it from different perspectives. But at the end of the day, big picture, we all care about the same thing, which is making sure this patient gets the correct diagnosis, gets the correct staging assessment, margin assessment, et cetera. We want to make sure that our patients are getting the care that they need, regardless of how we are contributing to that care. So I try to keep that in mind when having conversations or approaching cases and always be open-minded and have that perception and have conversations about that perception so that I can continue to grow as a person and make sure that the care I'm giving is understood appropriately by any member of my team.
Yeah, I love that. That's something I try to do even 20 plus years later. I'm still trying to, especially if we get somebody new in the department, trying to relate to them, trying to kind of, because you said you have to work as a team. And so you have to be welcoming to people. You have to get to know them. You have to build a relationship with every new person that comes in, which is not always easy, but I think it's really important to do.
Oh, absolutely. And again, like I look back 10 years ago, what I was doing then is very different than what I'm doing now. And I think that it's
Oh, yeah.
important to talk about your own professional growth and development throughout your career. I think when I was a newer grad, I was so focused on making sure I followed what I learned in school and had like this chip on my shoulder to prove myself as a new grad. And I was teaching students and residents right out of the gate. So I wanted to make sure I was doing that appropriately. I was so focused, I think, more on like my perception of the work that I was doing rather than the actual work, if that makes sense. Now I'm like, my work speaks for itself, and it's so much more important to build these relationships and to build foundational knowledge with the students that I'm teaching. That's rather than the step method approach of teaching, because I think I absolutely at one point was a step method teacher, and that
Yeah.
changed many years ago, and I've never looked back.
Yeah.
It's like those, we all grow as people and professionals. And I think that's really important. And it's good to reflect. Like you said, we're kind of reflecting on just the last 4 years, but I've been doing a lot of reflection over the last 10 plus, just kind of
Hmm.
thinking about where was I at one point, where am I now, and where do I want to be in our profession? And it is humbling, exciting, thought provoking, and also just fun to kind of think about the growth and the work that we do as PAs and the care that we provide and why it's so valuable.
Yeah. Yeah, totally. And I think I do that from time to time, that reflection you're talking about. I think it's very valuable, and probably everybody should do that at least once in a while.
Yeah.
Now, one thing you mentioned, and I think we've talked about this every time that you've been on, is the teaching method, right?
Mhm.
And you mentioned the knowing your why. And I want to talk about this again because I think it's a super important perspective. So let's talk about this again. So the way we've framed it before is the idea of teaching why instead of teaching how, right? Instead of the step-by-step method, like you mentioned.
Yeah,
All right. So let's go through this. Can you explain what this means?
sure. So it's really kind of more about teaching and focusing on the entire clinical picture for this patient rather than rote memorization of step by step instructions on how to approach a specimen. Why do we have this specimen in front of us? What are we looking for? Why is the specimen relevant? What pathology might be present? How do we assess that pathology? What does the pathologist need to see in order to sign out this case? Why is it relevant? If you understand the why behind what you have, the how kind of becomes second nature. It's intuitive. You know how to approach a specimen if you understand what you're actually looking for within the specimen. A lot of that, I think, essentially applies to understanding anatomy, pathology, AJCC staging, and CAP checklist and guidelines. It also just apply. I mean, you can apply this to benign specimens too. Things like the kidney, for example. Knowing what's relevant for staging, your cutoff sizes of 4, 7, and 10 centimeters. That's so important. But it's also equally important to understand that lesion extending into the renal vein is relevant. That's going to upstage you to a PT3. And that there's a very big difference between direct extension of a lesion in the kidney into the adrenal gland versus a separate tumor deposit. That completely changes how this case is staged, prognostic factors, all of these things that are really relevant for patient care. And if you don't know that when you're sampling the specimen, those things can be easily overlooked or missed if you're just memorizing steps because you're not always thinking to sample lesion to renal vein necessarily. You, of course, are going to take that margin, but you're not necessarily thinking, oh, of course, I want to see if this lesion's extending into this vein. And you should be. That's something that should kind of be understood. Same thing with mucosal margins on head and neck cases like laryngectomies, radical tonsillectomies, sclosectomies. Having dysplasia within 5 millimeters of a mucosal margin is a negative prognostic factor. And that's why when we gross those cases, those margins should always be taken perpendicularly because we want to be able to definitively assess that. If it's a shave, we can't get an accurate measurement, or I shouldn't say we, the pathologist can't get an accurate measurement of that under the scope. So if you understand that, you're never going to forget to take that margin perpendicularly. Versus if I just tell you, take the margin perpendicularly, if you don't gross that specimen for 6 months, you might forget and shave it. And then the pathologist is going to say, hey, I can't measure the distance of this. There's dysplasia here, I think. I don't know how close it is to the margin. But that's a problem. So it's really focusing on why we're doing what we're doing, how it's relevant to the patient's care, whether it be from a staging, grading, diagnostic, prognostic perspective, whatever that might be, and applying that knowledge rather than just memorizing steps on what to do. Because step memorization only will get you so far. You have to be able to adapt to what's actually in front of you so that every situation can be addressed appropriately. Because every specimen is different. Even every uterus is going to be different. Every kidney is going to be different. So just memorizing these steps is not going to be the most helpful thing for you to actually give that patient the care that they need.
Okay. I love this. I love this. And I want to get in a little more. Let's look at it from the other side. If you're the one teaching,
Mm-hmm.
right? How do you teach this? Like for me, Since I've been talking to you every year, I've really been trying to implement this method, and I like it a lot. And the way I've been doing it is, instead of telling them what to do, ask them a question, right?
Mhm.
Like, what are you trying to show, or what you need to show based on the tumor location, based on the staging, like that. Does that make sense?
Absolutely. I think that's the best way to do it. I mean, I treat every person that I'm teaching the same way I treat every specimen as a unique experience and a unique interaction because every person's different, their level of knowledge is different, and what they have in
Uh-huh.
front of them is different. So, how I approach a learner, whether it be a PA student, a resident, etc., I try to personalize that interaction and I ask them questions just like you do. The first thing I'll ask is, okay, let's go over. First of all, did you look at the staging of this type of malignancy or what types of lesions could be in this specimen? And if they say no, I'll say, okay, I want you to go review that first. Because I do think it's so important to understand AJCC staging and the CAP checklist for the specimen that's in front of you. So you understand what you need to show in order for the case to be signed out. And then once I know they're good with that, I ask them, about relevant anatomy. Can you orient the specimen for me? Awesome. Okay, what do you think you need to do here? What do you think is important? How do you want to approach this case? I definitely put a lot of that on them rather than me telling them what to do. I want them to think and actually understand what they're doing. Sometimes I'll say, awesome, great job. That's exactly what I was thinking too. Sometimes they have a different approach that maybe is not what I would have done, but it's still absolutely appropriate. So I say, awesome. I love that idea. Why don't you go for that? Here's another idea in the future you could use. And then sometimes maybe the approach is not the best idea. And I'll say, oh, I appreciate your perspective on that, but I think you should do this. And this is the reason why for that. I never just tell anyone just to blankly do something without explaining why it matters. I actually can think of a good example of that recently. We have a newer
Okay.
hire at my job who's lovely. She's bright, sweet, smart, and I can tell she really wants to learn and grow. And she has endless potential, this girl. And she had sectioned a liver wedge that was for cholangiocarcinoma. And she just kind of blindly sectioned the liver perpendicularly to the resection margin. And I told her, I was like, hey, one way to do it, and I understand why you were thinking that. We, of course, want to assess the margin. But I said, did you think about where this lesion's actually coming from? She's like, oh, I didn't think about that. I said, a better way to maybe do this would be in the future to kind of, if you can find that ductal margin, probe down that duct and then make sure you're sectioning along that duct because that's where the lesion's going to be present. And then you're getting that perpendicular resection margin to that lesion. But more importantly, you're ensuring you're maintaining the relationship of that lesion in the ductal system to the surrounding parenchyma so that when you go to section this specimen, you can really see the extent of it through the wall. Is it through the muscular wall? Is it going into the liver parenchyma? Because that's what's relevant for this case. And she's like,
Right.
oh, that's so smart. I didn't think about that. I said, yeah, no, I mean, it's not like what she did was wrong necessarily, but it's just, it can be even more improved just by thinking about what type of pathology is present. And I think we have conversations with learners, whether they're students, residents, newer grads, someone who just hasn't done something in a long time. It's important to consider that there's multiple right ways to do something, but there are also wrong ways. And it's important that when you're having a conversation about how to approach a case, you have an explanation. It shouldn't just be, oh, that's just the way that we do it, or because I said so. It should be based on the pathology that's present and how to best demonstrate that pathology in relationship to pertinent structures and, how to best assess it both grossly and histologically. And if you can explain that, I think it sticks a lot better for the person who's learning than just saying these random steps.
I like that a lot. That's a good example. I can certainly think of many examples like that from my own past.
Yeah. When you're like, oops, I definitely should have done this differently.
Yeah, for sure. You're listening to the People of Pathology podcast with our guest, Marissa Spencer. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know. It's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time-consuming. That's a problem because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first-of-its-kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using shortwave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104 patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstage 4% of patients from N0 to N1. I personally contributed to this study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to PathA, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. Now for the rest of this Pathologists Assistance Day special episode with Marissa Spencer on the People of Pathology podcast. One of the things that occurred to me, though, again, from talking to you the past 4 years, I try to, when I answer a question, it's never just, okay, just do this.
Mm-hmm.
I always try to go, okay, do this because this, which is sometimes hard to do. And you have to know what you're talking about, which can be difficult sometimes, but I try to add that in. So there's, like you said, there's the why, the reason behind why you're doing what you're doing.
Right. And I will say that makes you a stronger PA as well, because if you can explain it, that means you yourself really understand it. Because truthfully, like I
Yes.
said, 10 years ago, this is not the teacher that I was. I definitely was telling steps. And I think part of that was because it was in part what I was taught, but also I wasn't as knowledgeable in certain areas. And I myself didn't know why. And I remember at one point thinking to myself, you really should understand this. Like, we shouldn't just be blindly sectioning through something. There's a reason that this is relevant. And it's important that we understand that as PAs to be stronger PAs. And I made it my priority to learn that information. And I made it my priority to then teach that information, because I think that is what makes us better providers. I feel like it's silly. This is going to sound controversial, but anyone could gross, right? It technically, if you wanted to learn how to gross an appendix, I could show anyone how to cut an appendix, right? It's not like that's the part that's the skill that's necessarily challenging. It's not the technical part. It's understanding the relevance of that specimen and what needs to be shown to the pathologist. Even an appendix,
Yeah.
why are we longitudinally sectioning the tip? Well, because we could have an incidental carcinoid tumor in that tip of the appendix, right? So you need to know that's why we're taking that section. And then what does that actually look like? Because it's so easy for something like that to be missed if you're just memorizing steps, not really applying knowledge, and you're just kind of acting almost like a grossing robot rather than the provider that you are, and
Yeah.
actually focusing on the work that you're doing and paying attention and being mindful to the work that you're doing. And I think that when you're teaching, especially teaching's an added part of your job. It's not like it's your main job as a PA. So it takes time. And having these conversations where you are encouraging the learner to speak rather than you telling them things is absolutely time consuming. But that pays
Yes.
off so much in the long run, because if you do that up front, you help build that foundational knowledge, the foundational skill sets for that learner, so that they have the capabilities to work independently and you're not constantly answering questions. Because I see this again and again, especially with residents. It's so hard for them because they'll be in the grocery room for a very short amount of time. Where I work currently, sometimes they're only in there for 2 weeks at a time, and then they're not back for months.
Yeah.
And it's very difficult, or maybe years go by before they gross that subspecialty again if they're doing subspecialty grossing. And if they are not actually learning the material and they're just memorizing steps, even if they're a third year or a fourth year, when they come back into gross, they are going to have a lot of questions. And there's problems with that. Number one, they probably feel not great about that. It makes a lot of them feel like, oh my gosh, I'm a fourth year, I shouldn't be asking questions, which I do not agree with, but I do see that as a common insecurity for residents, is that they feel like they shouldn't have to ask and they feel like they don't need help. but they really do because they haven't retained that knowledge. But also it's a problem for you as a PA because you're like, oh, again, I have to step away. They should know this. That's kind of the perception that a lot of PAs have. But the reality is, if you're just telling them steps, of course they didn't retain that knowledge. It's going to go in one ear and out the other. But if you explain
Yeah.
to them in a way that they actually have to digest it, take it in, think about it, then they're really truly learning and they can apply the knowledge rather than just memorizing steps. And that's what's going to help you in the long run. If in first year or first few months with your PA students, you're really laying that foundational ground and taking your time, yes, it is a time commitment, but it pays off because then later on, they actually do understand the material and they're not coming back to you for questions that you feel are kind of repetitive or that's something that you feel that they should know already at this point.
Yeah. Yeah. And I think a lot of those concepts, once they learn, like you said, the foundational knowledge, they can apply it not only to the specimen in front of them, but it's transferable, right, to other things.
Absolutely. Absolutely. I agree with that 100%. If you understand why what the point of or the intent is of that case, and
Yeah.
the how is second nature. It's intuitive. You understand if you need ink or what measurements are relevant or what relationships are relevant. And that's kind of the stuff that is consistent, right? Like we're always constantly measuring things, weighing things, inking things, opening a certain way, etc. So that stuff becomes very transferable if you have foundational information that's there that allows the person to understand the pathology and anatomy present, then it's easy for them to kind of go off and gross because they really do have an understanding of something, not just a glossed over memorization of something.
I think from having conversations with some of our residents, I think it's especially helpful for them, for their boards, where they essentially have to do that. They have to take their knowledge and apply it to different things.
Yeah, and for PA students too. I mean, I think
Yeah.
about what our board examination is like too, and there is so much information that is not necessarily quote unquote PA work. Staging is relevant, right? And people will think
Yep.
it's not part of the
Yep.
PA's job, but I say it's absolutely one of the most important part of the PA's job is understanding staging because you
Yeah.
can't stage this case unless you section it appropriately and take the sections that are relevant for that staging. So it's really important that we understand those concepts and know how to apply them, whether it's on an exam or just in practice. And yeah, it's definitely helping as they get ready for those exams to make sure that they understand those concepts.
Yeah, for sure. I mean, staging is the basis for everything we do. And it's like all of the thinking, the logic that you use to figure out what to do with the specimen, it's almost all of it's based on the staging.
Absolutely. And even some of it's not necessarily I mean, it is staging related too, but like another example I think about, like students constantly will get TERPs and TERPs
Yeah.
confused, right? So if we have a TERP, a transurethral resection of the prostate versus a transurethral resection of bladder tumor, why
Right.
is one submitted entirely and one's not? And when do you know what to do with what? And I always explain to them, well, think about what you actually have. That helps you understand what to do. For the prostate, this is alleviating symptoms of somebody who has BPH. They have a benign process. So submitting representative sections is sufficient because we're not anticipating there to be malignancy there. There could be, but we're not anticipating it. Versus with the bladder tumor, we know already that there is lesion present. And now we're assessing the extent of that lesion. How far into the wall is it? What's the grade? Is it high grade versus low grade? And the only way to do that is just see the entire specimen under the microscope. So if you
Yeah.
understand the difference between these specimens and what the intent is for their surgical excision and assessment, then it's like, oh, okay, I know what to do with that case. So it's just kind of another example of understanding why we have what we have in the clinical impression and why that's so relevant, and then how to apply that at the bench.
Again, another example of the why, which is super important. Now, all right, so we've been talking about kind of how we've learned to be, I guess, educators over the past few years. Now, looking forward from here, do you think the kind of the state of pathology education, do you think it's going to change in the next few years? And then how do we get ready for that?
I definitely think it's going to change. I think there needs to be change, to be honest. When I think about
Wait, why is that?
I think about education in two different groupings. I think about PA
Okay.
education and then about resident education when it comes to pathology. And then I
Okay.
also actually think about education of our patient population. So those are kind of like the three things I think about when it comes to education. As
Okay.
far as
Love it.
PA education, I really think that it needs to become a little more standardized and in depth. And I know that's a controversial thing to say. NACLS has very vague, broad statements about what is required for PA education. And I understand the intent of that, right? It's so that programs can create curriculum given the restrictions or the structure of the university that they have and the resources that they have, et cetera.
Yeah.
But there is such a vast difference in some of the styles of learning and level of learning within programs. In the last decade, I've been a preceptor for 6 different programs, and I can see that there are some programs that are better preparing their students than others. Truthfully, I think there needs to be a little more meat to the curriculum and focus on things like staging and the pathology as well as gross prosection within PA studies. We have newer programs popping up. Some of them are excellent. Some of them, they're still kind of going through these growing pains. And I
Mhm.
see in the next 5 to 10 years, more and more programs are going to exist. And I really hope that while some programs are excelling at having really robust, important, or relevant curriculum, some of them are not. So I'm hoping to see that even out a little bit more over the next 5 to 10 years. I really think that's needed. As far as residency education, less and less of residents are spending time in the gross room. There's less and less time in the gross
Yeah,
room.
it's true.
And that I don't think is going to change. I think it's going to continue to be less and less. And because of that, we as PAs need to be more proficient, stronger, and also we need to be taught, kind of what we were talking about at the beginning of this conversation, how to engage with our pathologists and work more collegially and more in a partnership because that is what's really going to be needed. They're being so removed from the gross room. They are truly relying on us as mid-level providers to provide them the information and the quality sections that they need and good, strong gross descriptions to sign out these cases. So I see that honestly, one of the things that needs to change is kind of talking to residents about that, saying, hey, this is what a PA is. This is their training. Because I think there's a lot of lack of understanding of that, of what PA school actually is in pathology, and really kind of encouraging residents to have good, strong relationships with PAs and why that's relevant for patient care. I think that's something that needs to change. And then the last thing I think is going to continue to change, like I said, is that patient education perspective. We aren't patient facing, but more and more we're seeing patients actually learn about pathology because of things like social media. There are a ton of PAs on social media who are promoting content, and patients are now realizing, oh, there's actually another part of medicine that's involved in my care that I didn't know existed.
Yeah.
And I think that's a huge thing too. And I hope that continues to grow and thrive because, again, everything we do is for patient care. And as a patient, it's hard to advocate for yourself if you don't understand what's happening in the background. So I think it's important that we continue to be present in social media and kind of to our patient population to help them understand the work that we're doing and why it's valuable for them.
Do you think there's ever going to be a point where, because we always say that we're behind the scenes and the patients don't know who we are, and that's just part of the job. But do you think there's ever going to be a point where, because of this maybe social media exposure, that's going to change, that more patients will actually know that we're handling their tissue specimens?
Truly, I certainly hope so. I think even within healthcare, we're so misunderstood even by the providers that we work with. There are certain
Yeah.
things that surgeons don't recognize or radiologists or oncologists. And I think it is important for patients to understand pathology. And I honestly, I mean, I'm not a pathologist, so I'm not the one that's sitting down at the scope, but I have had patients come in and interact and want to see their specimens. Or I know I remember very vividly many years ago now, a little boy had gotten his tonsils out and he had asked, well, where do they go? And they asked us, can we show him the specimen? And I said, he's kind of young, but if parent signs off on this, I'm happy to kind of show him what this looks like. And he did. The father and son came to the department and they saw his tonsils and he was like, this is amazing. And thought it was so cool and had no idea that this is what was going to happen to his tonsils once they came out. His dad said, I think they're just going to throw them away. I said, no, we're going to look at them still. And some places do just throw them away for pediatric patients, but some places do
Sure.
look at them. And I think it's important as a patient to understand that process. And even knowing it's kind of like quality control, right? I mean, a lot of what we're doing is assessing the quality of the surgery that was performed. When we're looking at margins, for
Yeah.
example, we're ensuring that the entire lesion was removed from that patient. When we're looking at a lesion that was treated, like in the esophagus, and we're submitting the entire tumor bed, we are ensuring that there's no more viable tumor, that the treatment that you underwent was successful and shrunk your tumor, and now there's no more tumor cells. So recognizing that there is some sort of like almost quality control in the healthcare you're receiving, I think it provides comfort to some people. So being able to provide that resource of understanding and education to them is important, I think. And I hope it continues and that people jump into that. I do recognize though that a lot of people go into pathology because they don't want to do that component of the job, and
Yeah.
that is a challenge too. But my hope is that more and more providers in pathology will see the impact that the work that they do really does have on a patient and want to provide that insight.
I like that. Well, let me ask you this, because I've done a few episodes on these patient pathology clinics, right? Where the patient comes and meets with the pathologist
Yes.
and looks at their own slides and all of that. And I've been thinking, is there a place for PAs in that? You know what I mean?
Mhm.
What do you think about that?
I mean, definitely. I think there's a huge place for that if people can comfortably look at the macroscopic assessment, right? The gross
Right.
assessment. I mean, we have learners of all different backgrounds, not just PA students and residents at my job come in. Like people who are doing a PhD in neuro, for example, they'll come and want to see things from our perspective and what we're doing. And it's valuable for them to learn and to see this,
Yeah.
even though it's not necessarily their specimen. So I think, yeah, absolutely, there is room for someone to come in and see their placenta or their breast tumor. That might make them feel empowered to actually see, wow, this was in me. I can't believe this. Or look, I see why this is so important what they're doing. And they're really going to know exactly what's going on by looking at the tissue. I think PAs absolutely can play a role in that because it's not just the histology component that matters to the patient. Obviously, at the end of the day, tissue is the gold standard, and the histologic assessment confirms the gross assessment. So that is so, so important for the diagnostic component and finding out of the case. But for a patient, that might be something that's a little too in depth for them. They're not used to looking at microscope slides. They might not really understand that. But the tissue itself, I think them seeing that could make a major impact on them. So I think PAs absolutely should be part of that conversation and have the opportunity to show specimens to patients if their institution allows it.
Right. Well, that's a big if, of course, and
Mhm.
have to be supervised by a pathologist. There's a lot of things that would probably have to happen, but maybe not every patient would want to see that
Right.
anyways. But I think, yeah, I think you're right. There is a role for us in there, and it's still maybe evolving a little bit.
Definitely. And
It'll
again,
take
it's
some
it's
time.
based on the patient. Like, at the end of the day, we're serving this patient population, right? We're providing
Yeah.
patient care. What that looks like for that patient might be different. If they have an interest in that, I feel like I could never say no. Like, if it was up to me, I would love to be able to do that. If a patient, if it really was something that was going to be valuable for them and help give them some sort of closure or insight or whatever, help them heal. Of course, I'd want to take the
Yeah.
opportunity to do that. But that's not every patient. And also, that's not up to me, unfortunately. My job could say
Right.
absolutely not. And then there's nothing I could do. Or a patient might say, I have no interest in that. And that's completely fine. I think that the intent is not to force pathology down people's throats. It's more to just make them aware so that if they are curious and they want more information about the care that they're receiving, they can have access to that information.
Yeah. This is an interesting thing to me, because years ago, I was one of those people that liked this field because there was no patient interaction,
Yeah.
right? But now, if there was the opportunity to do something like this where I could show the patient their own specimen, I would love to do that. And that goes back to that reflection you were talking about earlier.
Yeah.
That's how one of the ways,
I
the many ways that I've changed.
I love that for you, though. I think that's great. And it's funny because to me, I know I could not be a patient-facing provider in the way that, like, nurses are, for example.
Oh yeah.
Some of my best friends are nurses, and I'm always so impressed by the work that they do, and I know personally I do not have the strength to do the job that they have to do. Yeah, I know I don't have the skill set for it, but this is different. There's something about my level of comfortability and confidence with pathology and explaining that in a way that someone who doesn't have that background knowledge and foundational understanding can understand it, that means a lot to me and I enjoy doing. And,
Hmm.
whether that be a high schooler shadowing, walking through, or someone learning about the lab, or an actual patient, and this is their case, I think it's fun to educate in that way.
Yeah,
And I would love the opportunity to do that more with patients if that opportunity presented itself to me.
yeah, yeah, totally. Me too. Okay, so I want to end with this because we've been talking about how great it is to be a pathologist assistant. And so if someone's listening and maybe they are, like you just said, a high school student or a college student, whatever, and they go, "Yeah, this sounds awesome. I want to do this." What advice would we give them?
Oh my goodness. So first, shadow. Find a place to
Yes,
get into the lab and
yes.
actually see it. I know that you have that program going on, Dennis. I don't know if there's a way to provide that in the link still in this,
Oh yeah, on LinkedIn.
but I think that's the most important thing is getting some sort of exposure to really understand what you're getting yourself into, because we aren't patient facing. So understanding what pathology is and what being a PA is in pathology, shadowing will give you that. And then my other big tip would be when you're looking at programs and you're applying to programs, don't just focus in on like the convenience of a location. Think about the program overall, do your research, and think about what really is going to be the best fit for you. Different
Hmm.
programs have different resources and opportunities and different styles of curriculum. And as people learn different in different environments. And I think
Yeah,
it's important to look at programs and think about what's best for you rather than just on the location. It is great. There's more and more programs popping up. There could be one right down the street from you in your backyard. That is great. And it's as far as convenience, that's awesome, but it might not be the one that's best fit for you. If it is awesome, but if not, don't let the location of a program inhibit you from actually exploring that program and going to it.
right. I like that. We had someone who shadowed with us quite a few times and got accepted to a program. I'm in Milwaukee, and so there's
Yeah,
two programs now that are fairly close to me.
right?
But she got accepted to one that was far away, and she was like, "What do I do? Do I wait for these other programs? Do I just take this?" And it's like, well, it is only 2 years,
Right.
and then now you're definitely accepted, and you've got that. You don't have to worry about it anymore. And it was a good program. It's been around a while, but I can see how that'd be a difficult decision to make because you have to move across the country.
Yeah, I mean, I did actually exactly that. I remember I went
Yeah.
I'm from Connecticut. I grew up in Connecticut, so I had a
Hmm.
program very close to me, and I ended up going to the program that was the farthest west at the time in the country. So the farthest I could be from home, and I did that because when I had applied to different programs, there was just something about that program that felt like the best fit for me personally. I just felt like it was gonna give me the, educational experience I wanted and opportunities, and I'm so grateful I made that choice because it's what led me to my fir this is cheesy, but it's true. I met my husband while I was there, which is wonderful. It led me to different opportunities within my learning experience in my second year rotations that I would not have had if I didn't go to that program, and every job I've had since then really all just kind of builds on the experiences that I've had. So I'm very grateful that I took the chance and moved across the country for this program, thinking it's 2 years of my life. Maybe I stay, maybe I don't know, but I feel like this is the best fit for me. So I always
Yeah.
recommend that to students.
Yeah, for sure. And you would like what you just said, take these opportunities, take them because you never know where they could lead.
Absolutely, absolutely.
Yeah. All right. Marissa, as always, this has been super fun talking with you, kind of catching up a little bit. I'm sure we could go on for another couple of hours.
We could talk forever. I'm a gabber, but I'm so appreciative of you having me again, Dennis. It's always such a pleasure to catch up with you. Thanks for taking the opportunity to hear from me and my perspective. And I looking forward to doing it again next year.
Yes. Happy PA Day to you, and we will talk again next year.
Happy PA Day.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from last year's special PA Day episode as we talk about some ways that we can advocate for the pathologist assistant profession.
If you train residents as a PA, when that resident goes off and does their fellowship and they work with PAs and then they graduate and they're going to work in surgical pathology, they'll probably be hiring PAs.
Yeah.
So advocating for yourself with everyone around you, what your scope of practice actually is, how you can be best utilized, and also saying what you want to do, what you want out of your job, ensuring that the work you're doing is based on the level of knowledge that you have. Don't be taken advantage of, but definitely utilize your skills appropriately and share them with those around you to help promote the future. Volunteering to get things out there, what you want the future of our profession to look like, helping with that would be huge. The AAPA is almost all volunteer-based.
Yep.
We're all taking our time out of our busy schedules to help further advance our profession. And it doesn't take that much time. Really, it doesn't. So if people want to get involved, I think that's a great thing to do.
You can hear the rest of that conversation with Marissa Spencer in episode 202. All right, as always, I really enjoy these annual conversations with Marissa Spencer because you can actually see the progression if you listen to all of them, not just in the profession, but in how we think about our role in it. One of the biggest themes that stood out to me in this episode is the shift from a more hierarchical relationship between PAs and pathologists to something much more collaborative. And that shift really depends on trust. Whether you're a new grad or starting in a new position, building that trust takes time. And it also takes confidence in what you know and the ability to communicate that clearly. Another key takeaway is this idea of teaching the why instead of just the how. It's easy in pathology, and especially in grossing, to fall into the habit of memorizing steps. But as Marissa pointed out, understanding the reasoning behind what you're doing is what allows you to adapt, to recognize patterns, and to handle cases that don't follow the script. That's what ultimately makes someone not just competent, but truly effective. We also talked about the future of pathology education, and maybe there's still a little work to be done there. As training environments change and residents spend less time in the gross room, the role of the PA as an educator becomes even more important. There's a real opportunity here to shape how the next generation understands pathology, not just as a task, but as a critical part of patient care. And I thought one of the more interesting parts of this conversation was around patient engagement. Pathology is often invisible to patients, but it doesn't have to be. There's growing interest from patients in understanding what happens to their specimens and how diagnoses are made. And PAs could play a role in bridging that gap, helping bring more transparency and understanding to the process. So overall, this was a really thoughtful conversation about growth, both personal and professional, and about where the PA profession is headed next. If you're a student or someone considering becoming a pathologist assistant, I think there's a lot here to take away. And if you're already in the field, hopefully it gives you a chance to reflect on your own approach to teaching, communication, and your role in patient care. So thanks again to Marissa Spencer. There aren't really many links to include in the show notes for this one, other than the Pathologist Assistant Shadowing Network, as Marissa mentioned. So if you're an aspiring PA and you need those critical shadowing hours, go to LinkedIn, you can find it there. Don't forget, you can follow this show at People of Path on Instagram, or you can just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists, pathologist assistants, and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.